gentlemen, welcome to the Afternoon Keynote. We are so fortunate today to have with us the CEO of Providence. Providence, as I'm sure you know, is the largest healthcare system in Alaska. Providence is the largest private employer in Alaska. Healthcare just would not be the same in Alaska without Providence. And we are so fortunate to have the CEO, Ella Goss, with us today to close this out, to talk a little bit about how we go forward from here together. So with that, thank you so much for joining us today.
Thank you so much, Vern. So I actually thought I was at an advantage speaking at 3:30 because I thought most of you would already have given up and gone home. But here we are. And I also realize that I am the only thing right now between all of you and the reception outside. And some of my friends in the audience, you know who you are, actually said, Vern, they'd have a better outcome or a better gathering if you brought the wine in. I might need some wine before this is over. Okay, well, thank you so much for having me. As Vern said, my name is Ella Goss. I serve as the Chief Executive for Providence, Alaska. I've been with Providence for 25 years, and I've been in the state of Alaska for 27 years. I didn't think I would stay, but here I am. I started at Providence, Alaska Medical Center as an emergency room nurse working the night shift in the emergency room. And since then, I've held a lot of different jobs within Providence. And one of them was as a flight nurse. And so as a flight nurse, I flew all over the state to pick up and bring patients to the tertiary centers in Anchorage, or in some cases, having to fly them out. So I believe that that experience has really grounded me in understanding what the healthcare needs are for Alaska. And after this very challenging time, what we need to do to move forward. So thank you for the opportunity, and thank you all for showing up. I'm actually kind of nervous and impressed at the same time. So renewal for the future. Providence, as many healthcare systems in our country right now and across the world, is experiencing a lot of difficulty, challenges. I hate it when I lose my words. Experiencing a lot of challenges, as are many other industries within our state and across the country. What Providence has decided to do during these very challenging times is to reduce our overhead and try to become more efficient. And you've probably heard about the organizational changes that are going on within Providence. The leadership and structural changes across Providence system are part of our path to recovery and renewal. And when I say our path, I mean Providence, and how we represent healthcare and how we show up in our communities. These changes will make us more nimble in response to the challenges plaguing us right now in our industry and across all industries. They empower us to provide more localized, patient-driven care to our communities. Work we've been doing since the Sisters of Providence first arrived in Nome 120 years ago during the gold rush. Our aim as Providence is to continue to provide the same level of safe, high-quality care that you as a community have come to expect from us. And our goal is to do it more efficiently, more effectively, and more collaboratively across our state and across other states. So we have a firm foundation. I just mentioned that Providence has been around Alaska for 120 years. The Sisters of Providence arrived in Nome in 1902 to serve the underserved and the most vulnerable in our communities. Our history has grounded us in the mission, and the mission of Providence is to care for the poor and vulnerable. On the left side of the page is the screen is the actual first hospital built in Nome in 1902, and on the right side are the sisters posing with the dog team that they actually were used as transportation when they were here. So Providence is built into the fabric of Alaska. As Vern said, we are the state's largest healthcare provider. We are the largest private employer. We have over 5,000 caregivers within the state. We are the only children's hospital, and by many accounts, we are the safety net hospital for Alaska. There is no county hospital, no state-funded hospital in Alaska, and we end up taking so many of those patients that would have nowhere else to go if we weren't able to care for them. But we wouldn't be able to provide these essential services if we didn't have the deep partnerships that we have with many of you in this room. We are so grateful for those partnerships. And as the Commissioners Crum and Koval talked about today, without those partnerships, we will not be able to go into the future, and we will not be able to care for our neighbors and our state citizens if we don't come together. So never have our partnerships been more crucial, more defined, or more collaborative than during the pandemic. The last 2 years were super hard. We came together and we identified the needs and we found solutions for our communities. And I'm just going to remind you, some of you absolutely know what I'm talking about. I'm going to remind you of some of the partnerships that we formed. COVID testing site. We came together very early in the pandemic, Providence, Alaska Regional, Alaska Native Medical Center, and the municipality, and we stood up a testing site during a very difficult time of uncertainty for our citizens. And they came and were able to have those tests done for free. As we watched what was happening throughout the nation, we stood up an alternate care site. Again, our Alaska Regional partners, our Alaska Native partners, the municipality of Anchorage, the Army Corps of Engineers, and the state of Alaska. All of us sitting at the table deciding how we could do this work to ensure that we were providing that care, a place to care for patients if we needed to. We stood up an on-site clinic at Sullivan Arena. Sullivan Arena became the care center for our most vulnerable population, our homeless population, when they could no longer be co-located at Brother Francis. We came together with South Central Foundation, Alaska Neighborhood Health, and the municipality to provide care in the Sullivan Arena during that time of the pandemic. My friends, the pandemic isn't really over, nor are the challenges that we face. Labor shortages, inflation, global supply chain disruption. Did I mention labor shortages? We are the most challenged we have ever been in the history of Alaska for workforce. But let's look at this as an opportunity to come together again to figure out how we provide care and stability to our great state. And these are pictures on here of the testing site in the top left corner. I was amazed. I didn't think anyone was going to work in March and April standing at the test site, 90-minute shifts in the freezing cold, taking registration, swabbing noses. And I went down, and I'm looking at some of our caregivers here in the audience who helped us stand that up. I went down thinking, okay, how are we going to kind of encourage people to come to work here? and they were turning people away. Our frontline people lined up, signed up, and provided this care. We could not have had that test site without our frontline people. So how do we redesign and rebuild together? Things have changed. They're never going to go back to the way they were. Healthcare is never going to be the way that it was. And Alaska, we always had the luxury of, we didn't have a lot of trouble recruiting. We had a really great reimbursement. And, you know, we sat on our laurels and thought, Alaska is great. It is, but it's going to change. So how do we rebuild together? When we ask these questions, we ask them so that we can inform our strategies of how we do this work together. So looking ahead, before the pandemic, Providence was looking at how do we build a clinically integrated network in Alaska. We do not have a whole system of care in Alaska. We have very, very, very good, siloed, independent, oftentimes disjointed pockets of care. Going forward, that's not going to work for us. The partnerships that we need to create, the partnerships that we've created, we need to continue with so that we can put together an integrated network of care so that the care passes through the continuum versus being so disjointed. Patients have a way of knowing how they get referred, who they can be referred to, and then what's on the other side of that. But a very clean continuum of care. We can only do that if we have our partners, and some of us are in the room, partner providers, our insurance partners, and our hospital partners come together to create that network of care. We've talked about bringing Medicare Advantage to the market in 2024. That's a partnership with the CIN that Providence has built, which is the Alaska Health Alliance. We've partnered with UAA. UAA needs to be our pipeline for our workforce. They do a great job. How can we help them do it better? How do we tell them what we need, help them with the programs, and ensure that they have preceptors and people who can help train people coming out? We started the Providence, Alaska House. It's a partnership with Widener Apartment Homes, Catholic Social Services, R4 Capital, Alaska Housing Finance Corporation, Federal Home Loan Bank of Des Moines, Rasmussen Foundation, Cook Inlet Tribal Council, South Central Foundation, HUD, Alaska Mental Health Trust Authority, Anchorage Coalition to End Homelessness, the Municipality of Anchorage, and Cook Inlet Housing Authority. Friends, if that's not a partnership to do something for our most vulnerable of our homeless population, we need to be proud of that. All of those entities came together to help us start the Providence, Alaska House. We are also looking at a crisis stabilization center. That is a partnership with the state of Alaska, the Alaska Mental Health Trust Authority, and the South Central Foundation. This crisis stabilization center will help us reduce the cost of emergency visits, reduce the number of unnecessary emergency room visits, and provide the right care for some of our most acutely ill in the community when they are in crisis. It is the right care in the right setting at the right time. Okay, these photos. So in the bottom left corner, those are nursing students who are in taking classes at Prince William Sound College in Valdez. Providence supports the program so that students can study remotely and be employed in the community that they grew up in. We all know if you can provide health care, employment, and education in the community, you can stabilize a community. The photo of the building, that is an architectural rendering of the soon-to-be Providence, Alaska house that I mentioned earlier. So, vision for the future. For Providence, the Sisters of Providence are our models of innovation. So if you think about in the 1850s, when women religious were called to come out west to care for people, that's a calling, right? They left their homes in Montreal, they moved to the western part of the United States, and from the western part of the United States, they came to Nome, Alaska, because they were called there to help care for people during the gold rush. They built schools, they built hospitals. And one of my favorite stories about the sisters is that they really kind of had the first insurance plan. The sisters knew that the gold miners had money, and so they went on what they call their begging tours. And they would go and beg for money with the gold miners so they could build the hospitals, provide the care, build the schools. The gold miners, in return, got health care at the hospital. So when you think about innovation, in 1902 in Nome, these women were amazing. Those are the shoulders that we at Providence and healthcare across Alaska stand on. They challenged us to, and these are the words of the sisters, search for new ways to carry out the mission, honoring Providence tradition, but not letting the past practice constrict the vision of what's best for the future. Don't let past practice constrict the vision or what's best for the future. They also said, changing needs, social structures, and institutions will require new and different responses. This is the legacy they left us, and we never needed those words before like we do today. They also expected us to address the emerging needs with wisdom and discernment. And friends, it takes every one of us in the room to have the wisdom to what we need to do, to think about what is the right thing to do when we are looking at how we care for our fellow citizens, our neighbors. I invite you to get creative. I've just mentioned all these partnerships. I've mentioned all the things that we need to do. I've talked about vision. I've talked about redesigning, rebuilding. I've done a lot of talking, but I'm also now inviting you. Be creative. Know that anything we do from here on out will be the backbone of how we continue to meet the needs of our communities for the next 120 years. In this photo, these are the caregivers who provided care at Sullivan Arena. And then the other picture is one of our caregivers at Providence St. Elias Specialty Hospital. And thank you.
We have a couple minutes. Thank you. So we have a couple minutes. Are you okay with a couple questions?
Well, does everyone want to go and have a drink now? Because if you do, but yes, of course.
I think the answer is yes to that. So we'll be brief, but just a couple things. You've really described quite a mission, and I love the part I just wrote down, search for new ways to carry out the mission, because that's so important. We have to continuously reinvent ourselves if we're going to be successful going forward. There are so many things that I'd love to ask you. Let me just ask a couple things. I mean, we didn't talk about what I'm going to ask you here, but just Medicare Advantage. Alaska is not a state where managed care has a foothold. What is the prospect, and why are you pursuing that? You just mentioned it briefly, but it just stuck out to me.
Great question. I was hoping nobody would ask me about it, but okay. So Medicare Advantage, many of you probably know that Alaska is the only state that does not have Medicare Advantage. And in other states, at least 40% of the people are enrolled in Medicare Advantage. The idea of Medicare Advantage, Vern, is to provide care for more people. One of the most difficult and trying things on our healthcare system is when people don't have coverage. So that one, inability to have healthcare, or two, inability to pay causes us to have higher costs because people are not coming in and having healthcare for preventative maintenance or coming in when they're not as sick. So making sure that more lives are covered and that we have affordable care in Alaska so that everyone has the ability to have health care. With Providence, we believe health care is a basic human right, and so we believe that everyone should have health care.
Yeah, full disclosure, I am on Medicare. I am enrolled, along with 40% of Medicare beneficiaries nationally. I'm enrolled in Medicare Advantage plan. It works great. And the forecast is that more than half of Medicare beneficiaries will be in Medicare Advantage within just a few more years because the trend line is in that direction. So it just really struck me as interesting that you had mentioned that. Let me just ask one other thing because it is about time. So how do you keep care in Alaska? You know, we have all these challenges now. You mentioned them, the workforce issues that are here, but how do you keep care in Alaska when so many people are seeking care elsewhere?
Well, that's such a loaded question, Vern, and it's also really difficult to answer. So our goal, I think everyone in the room understands that you heal better when you have health care at home. You heal better when you're around your families. So anytime we have the opportunity to keep care here, that's exactly what we want to do. Part of the problem is affordability. So we know 2-3 years ago, the 3 most expensive cities to have health care were Anchorage, Juneau, and Fairbanks. That is not a statistic that Alaska wants to have, right? So we have to work together. This is all about the partnerships. You heard Commissioner Crum and Commissioner Koval today talk about how important it is to have affordable, sustainable health care. That is what we need to do as a partnership. If we can provide affordable, sustainable health care to our citizens, we wouldn't have people seeking cheaper health care in other places. And we would be able to afford to have more specialists, more providers who could come here and have the volume that they need to be able to provide those services.
So, well, very good. Thank you for being a good sport with a couple questions there. We have reached the end of our time, and that means we have reached the end of the conference. And I just want to extend a thank you to you for being here today. So much of this conference really depends on you as the audience as well as the speakers. And so we thank you for taking the time to be with us today. I can tell you from my perspective, just a really, really good 2022 State of Reform Healthcare Conference. So thank you very much. We look forward to seeing you next year. Thank you.